Hello? Anybody there? Hello?
Hello?
I need to go to the restroom.
Okay, can you wait a couple minutes?
Yeah?
Yeah, okay, I'll be there shortly.
Thank you. Hello? Nurse? It's been 15 minutes. I really need to go. And I'm on fall risk, so I need some help. Can you come now? This thing working? Hello? Hello? Forget this. Alright. Get on my own. Oh, my legs. Oh, my legs don't move. Oh, boy. There we go. Help! Help! Help!
Good afternoon. We're going to be talking about fall risk and prevention today. Fall risk and the related injuries have varying definitions. They can be due to intrinsic or extrinsic factors. Intrinsic factors can be physiologic in origin, which would be your age, your gender, and your cognitive impairment. Your extrinsic factors are precipitated by environmental or other hazards. Inpatient fall prevention has been an area of concern in nursing for over 50 years. Traditional hospital-based incident reports deem that all inpatient falls can be avoidable. Inpatient fall rates range from 1.7 to 25 falls per 1,000 patients per day, depending on the care area.
The trends of areas that nurses fall short in are inadequate assessment, communication failure related to patient handoffs, and lack of adherence to safety procedures. Inadequate assessment in nursing falls into risk assessment issues like the Morse Ball Scale, gender and age, level of physical function and use of assistive devices, cognitive status, and what medications they're on. Communication failure often happens during patient handoffs. This could be avoided by using the technique associated with I pass the baton and SBAR. Lack of adherence to safety procedures include inadequate lighting, not answering call bells or bed alarms in a timely manner, and not providing patients with non-skid socks. As you can see, these are simple options, but when overlooked, they can cause major complications. Now over to Oz, where he's going to be telling you about the latest research on patient factors.
Do medications play a role in risk fall factors? According to recent research, antihypertensive, antidepressant, antipsychotic, and anti-epileptic your non-steroidal anti-inflammatory drug NSAID are just a few medications associated with falls. Adequate teaching is necessary to prevent any possible falls. Explaining the necessity of wearing non-skid socks, of wearing fall risk bracelet at all times, and notifying the nurse for any needs are necessary. Patient and nursing compliance will be necessary to prevent any possible falls. Back to you, Melissa.
Institutional issues could be due to the deficiency in the physical environment at the healthcare facility, inadequate staff orientation and equipment teachings, and the average of staff on the floor versus the patient volume. Prevention in the physical environment would include bed alarms, fall risk bracelets, non-skid socks, motion detection patches, bed alarms, hip protectors, and assisted lift devices. Inadequate staff orientation and the continuing teaching related to fall risk falls into teaching them to adjust the environment to promote safe patient movement per patient per room, train them for fall assessment, risk, and post-fall assessment, examine constellation of disorders that might precipitate their falling, use of side rails and armbands, and the importance of checking on these every time you round into a patient's room, and teaching them how to adequately use an assisted lift device and to get staffing help when needed to use these. The average staff on the floor versus the patient volume could be to study the barriers to maintaining and sustaining the monitoring activities, the ability to provide toileting regimen in a timely manner for patients, the ability to delegate necessary tasks to all the appropriate staff. In conclusion, adequate nursing knowledge has the potential to identify fallers before an incident even occurs. They can be done through fall history, identifying gait problems, checking for impaired muscle strength, knowing that they have increased toileting needs, postural hypertension issues, any comorbidities that may be present, medications they are on, and any assisted lift devices they may need. These should all be done upon admittance to the hospital, upon arriving at a floor, and during your shift as you round.